I was a drug addict starting from 2012 until this year, 2024. I was injecting myself, I was using heroin. I didn't even have hope anymore in my life.
You know when you feel like you're not a human being, and you're treated like you're not a person or statistic?
With addiction, it's difficult. You know, when you are in that life, you are controlled by addiction. I find the job very fulfilling as a social worker because I've seen people coming from really, really, really dangerous and bad situations to becoming my colleagues.
What I do when I wake up in the morning, I think about this population and I figure that they have no support structure.
When you're dealing with people who use drugs, they are discriminated against, the stigma around it. The biggest issue is that they get to be violated mostly, being denied services, being beaten.
The importance of harm reduction services to women who use drugs and young key populations, it's actually a right and a freedom to access these services. The main challenges that they face daily, it's actually discrimination, where communities reject them. Remember that women who use drugs are really discriminated against and they go through so much trauma. You're seen as you're a mother and everyone is expecting mothers to be perfect. And everyone is associating drug use as the taboo. Why using drugs as a woman? So if we have services like this that give them, a breather that makes them comfortable to talk about their stories and to actually combat, the health and lifestyle that they go through daily.
By 2020, I found out that I was HIV positive. The life we live here on the streets, we get raped, like by people we know.
We provide counseling, HIV counseling to the community at large. We screen them for TB, we screen them for STIs, and then after that we link them to care to the facilities.
Harm reduction is used for prevention of HIV and AIDS and TB. We do HIV testing, we do needle distribution. With the needle distribution, we use that to prevent sharing. The community, when we distribute needles, they take it as if we are promoting that they should continue using drugs. They don't understand that it's a package. You distribute needles, but you will still educate them about the dangers.
Part of the program, we now have OST, which is opioid substitution therapy, whereby we provide patients with medication to help reduce cravings and withdrawal symptoms if they had not used heroin. And by that, we try and win them off the heroin.
We started when there was no treatment, there were no ARVs, and we became part of the solution to provide professional counseling. So as a project, we meet the needs of the community as they arise. And it is our dream that we impact our community and we see change, as we have seen the change in the past.
We build a relationship that lasts. It's not a once-off relationship. You come to the site, they will come, even if they're no longer receiving our services, they come and greet us, they come and check on us.
So communities need to support them, communities need to understand their journey, communities need to understand their choices, and communities need to understand that they are not different from an ordinary person who doesn't use drugs. So that you can hear the story behind, because we all have stories to share. We all have journeys we've all lived.
In 2026, you are waking up. Where are you waking up? What do you see?
I'm waking up in my own house with my family, my little sister, and going to work every day to go help other people, working to give others the life that I didn't get, so then they can get a better life.